Good morning. Alarming surge. The coronavirus spiking across 21 states. Cases now topping 2 million nationwide. Hospitals from coast to coast being overwhelmed once again.
I think people have let their guard down.
A new warning from a Harvard scientist predicting another 100,000 deaths by the end of summer. He'll join us live. Warning the coronavirus pandemic and new concerns about a large spike in cases since the unofficial start of summer. Some hospitals now fearful of a potential shortage of beds for patients. In a moment, we're going to talk to a doctor who says drastic action is needed right now. But first, NBC's Aaron McLaughlin is in one of the country's hot spots in Phoenix, Arizona. Morning, Aaron.
Good morning, Hoda. Nationwide, the numbers are staggering. More than 2 million confirmed cases, over 113,000 deaths. Here in Arizona, the number of cases skyrocketing, so much so that public health officials are warning hospitals such as this one to prepare for a crisis situation.
This morning, across the country, growing alarm over new spikes in virus cases, 2 weeks after Memorial Day weekend, when many ventured out in crowds. 21 states now seeing an increase in cases in the last week. In Florida and New Mexico, cases up over 40%. In Arkansas and Utah, which never had statewide stay-at-home orders, cases up over 60%. On Wednesday, former Utah Governor Jon Huntsman, who's running for re-election, announced he's tested positive.
The symptoms that I've been feeling for the last couple of days are in fact what I suspected they were.
Since Memorial Day, there have been spikes in hospitalizations too, from the Carolinas to Arizona, where last week cases surged an alarming 93%. Arizona health officials now urging hospitals to activate their emergency plans. Dr. Marjorie Bessel runs the largest hospital group in Arizona and says if the numbers continue to rise, they may soon reach ICU capacity.
Is Arizona a cautionary tale for the rest of the country right now?
I think that our current trend is a cautionary tale. If you're not physically distancing, if you're not doing all the other activities that we've been talking about, there is a price to pay.
Arizona began reopening back in mid-May. The governor, Doug Ducey, is often seen without a mask. He says Arizona's not in crisis, has enough hospital capacity, and attributes the spike in cases to more testing.
As you see an increase in testing, you will see an increase in cases.
Some officials disagree, also pointing to people's behavior. An audio of a White House task force call with governors on Monday, obtained by the Daily Beast and confirmed to NBC by a person familiar with the call, Vice President Pence and Dr. Deborah Birx worried about a spike in cases 2 weeks from now, after the recent protests nationwide.
Having already instability and then the level of protest, the close packedness of the protest piece, and the fact that not all of them wore masks.
Birx warns states need to prepare for a new surge as they continue to reopen.
Task force also says it's concerned about the number of testing centers destroyed nationwide, at least 70, they say. Also, the big message here from health officials: wear masks and social distance as states continue to reopen. Savannah?
All right, Aaron, thank you. We are joined now by Dr. Ashish K, the director of the Harvard Global Health Institute. Doctor, good morning to you. You just heard the report. You've obviously seen the numbers. How concerning is this spike in cases, and what do you attribute it to?
Yeah, good morning. Thanks for having me on. So the numbers are concerning, particularly in states like Arizona, North and South Carolina, Florida, Texas, places where we're seeing pretty consistent increases. It is about 2 weeks after Memorial Day that we're seeing this, and this is what we were worried about. I had hoped that the fact that people are spending more time outside, that it's summer, we would not see such a big increase so fast. But it's more concerning than I had hoped we would get at this point.
And then that just raises the question. Obviously, we've seen, thousands of people out on the streets night after night, some trying to practice social distancing and wearing masks, but yet we've seen the images, many of them packed together. Do you worry about a further surge because of that?
I do. I think protests are also going to fuel more cases. The key is here that people do need to be wearing masks, and I've seen some protests where most people are wearing masks, others where people are not. It's really, really critical that people wear masks, because we think that as the data is coming in, that can really help a lot.
Let's talk about the surge of cases, because many people say, well, aren't we testing more? Doesn't that explain the numbers? And I wonder if you could put that in perspective, and what are the numbers that you look at to determine, okay, what is suggesting an outbreak and what is just a function of, hey, we're testing more, you're going to get more cases?
Yeah, so testing does help identify cases, of course, and so we have been so behind in our testing approach for months that we were missing most of the cases out there. So as testing's gotten better, we've identified more cases. That helps. But testing's not going to explain the increases in hospitalizations, right? That is coming from just more people getting sick and needing hospital care. So I think testing is a part of the story, but certainly doesn't explain the whole thing. You know, I look at all of it. I look at testing, I look at cases, hospitalizations, and death, and really try to look at case numbers and ask how much of that can be explained by testing. Some of what we're seeing can be, but not all of it by any means.
You have a very dire prediction about the number of deaths we're going to see in this country by the end of summer, by September, 200,000. And I believe that's a rather conservative scenario. Can you explain how you arrived at that number and what can be done about it?
Yeah, so this is obviously very concerning. We right now have between 800 and 1,000 Americans dying every day from coronavirus. And when you put all the models out there together and you look at really the consensus, if we just stay flat, if we don't have any more spikes all summer and just stay flat, we'll continue to have 800 to 1,000 people dying every day. That's about 25 to 30,000 a month. And over the next 3 months, we will cross the 200,000 mark. We're at about 113,000 now. So sometime in September, we're going to cross 200,000. And we still won't be done, right? This pandemic is going to be with us till next spring or summer when we have a vaccine. So this is not fated, by the way. We don't have to live with hundreds of thousands of Americans dying. We do have to get people to wear masks. We do have to do as much social distancing as possible. And while we've gotten better on testing, we're nowhere near where we need to be. And we really need the federal government to step up and decide that it doesn't want to have hundreds of thousands of Americans dying and help states ramp up testing and tracing. That's the other piece of this that's still missing.
So you're not suggesting another nationwide lockdown like we had that was obviously so devastating to the economy, but you think there's something short of that that would make an impact so that we don't have 200,000 deaths by September?
Yeah, you know, the key here is the longer we wait, the harder it is to avoid the lockdown. We basically ignored the virus for all of February and a good chunk of March, and then we had to shut down. And my point is, let's not do that again. Let's do everything in our power to get the virus under control so we don't have to go to another lockdown in order to avoid all these deaths. I think we can. We absolutely can. I don't want a lockdown. Nobody does. But if we just act like the virus isn't there or somehow it has magically gone away, we're going to be confronting a much uglier reality, and I don't want to do that. I want to be proactive on this, Paris.
Dr. Jha, it's good to get your perspective this morning. Thank you very much for joining us. We appreciate it.